What happens when you can see the whole picture, the body, the history, the invisible threads connecting it all, but that clarity becomes its own kind of burden? Welcome to Unpolished Wisdom, a space for conversations that are beautifully imperfect, raw, unfinished, and deeply human. I'm Dr. Katrina Gisbert-Tay, a medical doctor and executive well-being coach. Through my work, I help people navigate transitions with honesty, courage, and compassion. And today, we're joined by Dr. Loo Hui Voon, an integrative medicine doctor who bridges conventional family medicine with functional and nutritional approaches. She's a doctor people find when they've seen everyone else, when their cases are complicated, when they need someone who can look beyond symptoms to see the whole person. But here's what makes this conversation different. Dr. Loo knows what it's like to be the woman everyone comes to for answers, while quietly wondering who holds space for the person who holds space for everyone. There's a conversation about the particular exhaustion that comes from seeing it all, caring too deeply, and the sacred challenge of filling your own cup when you're constantly pouring into others. Welcome, Hui Voon, and thank you for being here.
Thank you, Kat, for inviting.
So, as I mentioned in the intro, right, you trained as a family medicine doctor, but you kept going. I know you like to study and like to get all of your certifications. You did a fellowship in nutritional medicine. You did Institute for Functional Medicine. You did the Walsh Research Institute and many, many more, which is a lot more training than people would normally get, doctors would normally get. What called you personally to this more integrative, whole person approach?
I think it started with my aunt being diagnosed with Alzheimer's disease at 40 years old. That was a long time ago, probably more than 20 years ago.
Yeah.
I was very close to her. And knowing what medicine can provide then was very limited. And I got to know through a friend about nutrition medicine. I went in and explored. I was like, wow, this is a different world. So I apply a lot of the principles for her, and you actually see improvement in her kind of brain functions. And she did pass away eventually, as we know kind of how dementia is. But it just kept, because of stepping into that part of the world, it just caught me to kind of be aware there are more options that are available, and started my whole journey since then.
Yeah. And you've also applied these principles to yourself and to your family. Can you tell me a bit more about that?
Yeah, I do. I mean, personally, I've been through myself with body pains and aches after having my son 14 years ago postnatally. As usual, people say it's postnatal fatigue, breastfeeding, not enough sleep, poor sleep, all sorts of reasons. I have to see TCM every week, the acupuncture, to relieve the pain. Then somehow one day I say I should have just done gluten-free. So I took it out 3 days, all the pain went away.
Oh, that's
All the
amazing.
backache, neck pains.
With
and
no medication.
no medications.
Wow.
I prefer not to take meds. So that was like, hey, yeah. Before that, I was kind of still on a little bit of the gluten on and off. But when I went off it completely, it was quite 3 days.
Oh, wow. That's crazy.
Yeah.
That's very fast.
Yeah.
That's
3
very
days,
fast.
yeah.
And you've also applied the gluten-free, dairy-free principle to your kids.
Yeah.
What was the impetus for that?
I mean, my son was sick when he was about 3. He had some autoimmune disease. At that time, I already know about nutritional and functional medicine. The specialist didn't have much to offer apart from steroid. So of course, I'm not gonna put him on steroid.
You don't
for
want
a
him on long-term
3-year-old. Yeah,
steroids.
so I took him home and I started the whole journey. He's improved a lot, I guess, in terms of the autoimmune diseases. It's fine now. Then since then, the house has been dairy and gluten free, and additive free, processed food. Trying to be processed food free.
As much as we can.
As
It's
much as
very
we can.
difficult.
Yeah, it's very
but
difficult,
with
yeah.
teenagers, that's a
Just
bit
yeah,
hard.
yeah.
And you mentioned, we mentioned earlier that I refer patients to, and you see a lot of patients who see you as their last resort. The ones who have the complicated, multi-layered health issues, who are really hoping that maybe Dr. Loo's going to figure it out. What's it like, though, to be that person? To be that person who sees what other doctors may not have seen? I call you the great connector, right? You can see and connect the dots in things that others may have missed, but you also carry the weight of being that person's last hope. What's that like?
I think that carrying the person last hope, it's quite a big word. Yeah. That sits very heavy on the shoulder. No doubt it does gives as if a very heavy burden. But I often now take a step back and I kind of tell myself I'm not God. If I may be able to help the patient to relieve some of the symptoms with guiding his or her journey at the moment, that's my role to play. So I no longer carry, initially I still have that heavy burden, now I no longer carry, I kind of put it aside and just leave it to the universe to guide. Yeah.
And so what do you see as your role? As a physician, what is your role? It sounds like it's shifted for you.
It shifted for me, yeah.
So what is it now?
I see myself as maybe part of the journey with them at the moment. Once my journey with them is done, they will find somebody else to guide them along because everyone has their path. If I'm meant to help them more, I will be able to help them more. Yeah. But instead of putting that pressure on myself, and I realized taking that pressure off actually works better because I feel less burdened. I give better results. Yeah.
Oh, definitely.
Yeah, definitely better results. Yeah, the patients feel better faster. You kind of know what is the option, what dose, what treatment, what to give. Yeah, even who to refer.
Yes.
If I can't be the one to help, who can I refer the patient onwards? Some patients fly overseas to treat. I mean, I know there's no other options here. And they do recover. Yeah, and it's nice when you get an email from them.
Oh, that's
knowing that they have improved a lot.
That's wonderful.
Yeah, even a year down the road. Yeah.
And what's wonderful too that I'm hearing from your journey is that it has to start with you.
Yeah.
The healing journey has to start with you internally within yourself, right? And it's not just physically, but mentally, emotionally, spiritually.
Yeah.
And talk to me a bit more about hope. Because I think, medically speaking, we don't talk about that so much. We weren't, it wasn't a subject in medical school either. But I'm sure you've seen and I've seen in my practice, which is the moment you give a patient some hope, actually miracles can happen.
Yeah.
Have you seen that as well?
I think it's a bit tricky to say that miracles can happen. Also be mindful not to give too much hope because hope, depending on their expectation, if it doesn't achieve, it comes with another disappointment. And for this population, they've gone through rounds and rounds and rounds. So I would think like setting them in the right expectation will be the first thing to do. Yes, I have seen miracles which I didn't expect it to happen still. But I mean, they are coming in because they are also desperate. It's showing that they have run through specialists and specialists and specialists around the world, and I'm like, I'm not getting any better. So it's also important not to offer false hope. So it's just sharing some of the knowledge or whatever studies that has been not fully utilized medically yet, but it's in the forefront that it's safe to explore. So they don't end up, taking things that's selling completely false hope.
Yeah, of course.
Yeah.
Of course.
So,
and for me, I think, and when I meant miracles can happen, what I've seen with patients is for them to shift their motivation.
Yeah.
For them to start believing that the word for me is empowerment. That they are empowered to be able to shift their destiny, that they can be the captain of their own ship.
Yeah.
And sometimes it's not about the big changes. It's everything you said earlier, right? It's sleeping a little bit better, feeling better, feeling not, having an upset stomach or being so bloated all the time. And like in your story, just not having the pain every day. And that's where I think that little 1% makes such a big difference.
Yeah. Very big difference.
I'm curious also because you said, yes, you aren't God, you're not the panacea, you don't know everything, but for sure the patients come to you expecting you to have all of those answers. And what do you say to them?
I usually set their expectation, tell them this is going to be a journey. I do tell them upfront that there's no guarantee.
Yeah.
We can only try the best. I will be your guide on the journey. Yeah. This is a two-way relationship in terms of the medical piece. It's no longer what they were experiencing probably in the hospital. I tell you to do this, you do this.
Yeah.
No, it's like the whole didactic, a bit more doctor-patient relationship. It's more for like teamwork.
And what does that look like in reality? So if you have a patient that comes in and you say, look, I'm not here to dictate to you. I mean, of course, you'll have your protocols and all of that.
Yeah.
But at the same time, the work needs to be done by the patient.
Yeah. So I could have a plan or a protocol, but they will have to tell me, is this going to work? I am very busy at the moment. This is not going to work. I have a sick kid at home. I'm traveling. I have a sick parent. So this plan will have to change to accommodate what they can do. The other piece is cost, financial piece. If there has to be a give and take, which one do I take, which one do I not use? Like you can have the perfect treatment protocol and plan. If the patient struggles, that's the worst plan ever. Yeah. So, and they will also have to tell me as if like, does this work? Does it not work? Is the dose too high? So they will have to report to me how they feel once they start on the treatment plan on the protocol. That's kind of what I shared about the team. If they don't tell me anything, I don't feel anything, I don't know what's happening, then this is not going to work out.
Yeah. And I know that you work with your patients not just on the physical aspect. There's, also the emotional, the mental, and you work with a team, you work with other people, so you do refer out. And what have you seen has been the impact of looking at the patient holistically?
I think the biggest impact it's looking at their emotional state, the mental health and the past trauma. And the trauma piece, that's one of the biggest piece in so-called patients that doesn't recover with medication or patients that still have symptoms despite going through hospital visits. And yeah, I think the medical field it's still got a lot to catch up in terms of how trauma can lead to physical symptoms. It's probably labeled as psychosomatic in the medical field, but there's way to address, but not by drugs, but working with the right trauma-trained psychologists or psychotherapists. Yeah, I've seen amazing results.
Wow. And also working with the body, the somatic. I think a lot of people forget that. I've said this before in the podcast, but I've noticed, and there are doctors too who think this way, which is we're just brains on a stick.
Yeah.
Right? But actually, so much goes through our body that we don't realize, that stays with us. And the question is, do we even recognize that it's still there?
Yeah.
I think that's the big one. But for some people, it may be difficult to confront.
Yeah. So usually those, first you have to make them feel better first with maybe not drug approach, with lifestyle changes, maybe with some supplement or herbs or anything they are comfortable with.
Yeah.
Once they do feel better, then they will slowly willing to explore further. Yeah.
If I may ask a more personal question, if that's okay. What about for you? What did you have to let go of in order for you to really start healing yourself and take care of yourself, to hold the space for others? Because that's what you do, right? You hold the space for so many people.
I think for myself, I do quite a fair amount of, I think working with a therapist has helped. Working with the inner child work and doing somatic work myself with my therapist. Also having people that, like you say, like supports me. It's very important. I have my own mentors. I have my own physicians. I have my own cranial sacral therapist, my own osteopath, my own TCM doctors, my acupuncturist.
It's a village.
It's a village. Yeah, it's a village. Yeah. That is. I do think working with right therapists, it's really powerful because it addresses all the way back to it's a belief system change. It's how you respond to a demand. How it's the inner child piece is actually very, very powerful.
Oh, incredibly. And if it's okay for you to share, what was it that your inner child was trying to tell you that perhaps you hadn't listened to for a long time, that now actually said, actually, no, I've had this conversation with my inner child and we're in a good place? What would that be?
This is probably letting go on what you hope to achieve as a child, like your bigger self telling you, no, that's fine. And also acknowledging that you're not perfect. You don't have to solve it at one go. Feeling comes, feeling goes. Sometimes you're good, sometimes you're not so good. That's normal. And give body time and space to move with you. The body needs time. It cannot just change the next day.
Oh, totally.
Yeah.
Totally. And I think, I can share my experience, and when I was practicing, and even now, which is I feel like I can move at the speed of light. I can do things really quickly because that's just how I've always done it, right? Whether it's in the hospital or it's in my coaching and the consulting that I do. But the body will take its toll. And especially now, it's, in our 40s, right? Perimenopause is, coming up. And there are other battles that, our body has to deal with. I think it's so much more important to listen and pause and stop.
Yeah.
How do you do that? Because I know you're so busy. I know you see so many patients. How do you do that in your day?
Let's see. I start with a walk in the morning. So I walk to work every morning. That's a must. Not negotiable. The walk is not just for physical exercises. It's actually mainly very good for the mental space. It's like I do some meditation walking. Some days I run there. So that's a very powerful tool to ground me. Meditations every day. I think blocking time off on the schedule is important. Very important. So again, that becomes, nothing comes in to those timing. Even the free days are not meant for me to do other things that relate to work. It's completely off. It's only for the kids and the family. And I think, to be honest, living in Singapore, going for holiday really helps. Going somewhere with nature, the space, it's huge. I love to see. And just slow down. The time actually slows down when things doesn't have to be so fast paced. That's actually powerful. And of course, my family is a very big supporter. Both of my parents and my parents-in-law are also very supportive.
Yeah, of course. And your husband, of course.
Oh yeah, that's the most important.
Yeah, most supportive. No, for sure. And we both trained in functional medicine. And one of the things that strikes me about it is that once you start seeing the body as an interconnected system where, like you mentioned, right, the gut will also affect mental health, where hormones will connect to sleep, where stress lives in the thyroid, you can't unsee it. So I'm curious for you, what was the cost, if any, and maybe there isn't any, for you of holding all that complexity for your patients?
You can't unsee what you have seen. Once you know and learned and you have had patients that really improve. I mean, example with autoimmune disease reversing, antibodies is reversing, they are dropping, other symptoms are better. It's you can't unsee what you have seen, and that's probably the main piece that you drive you to just move forward. It is a lot of work. It's a lot of unseen work behind. It does drain a lot of energy
Yes.
because you're not just listening to the physical piece, you're actually listening to their stress, lifestyle, their emotional, whatever they are going through, kind of listening to their whole journey at the same time. It's as if you're riding with them.
Yeah.
But like I said, I can't block it already once you've seen it. It's
Yeah.
yeah.
And has there ever been a time when you've experienced burnout?
Oh yes. Yeah.
Talk to me about that a little bit. Tell me about that. What was that like?
I think that's probably a few years ago when the practice got really busy. And I think there was a wait list of about a year. And with the usual, most people, you want to meet people's demand, you want to meet what they want request, and you're getting appointments full, but you were so full that I can't see anymore.
Yeah.
I got so tired and I was start wondering, am I doing the right thing? Yeah. This is the burnout was real. It's as if you just like I don't want to go to work. Though I like the work a lot, but I don't want to go there because I'm too tired. I don't have any more space in the heart to feel. It's not so much of thinking work. I took a few weeks off and then took a step back and realized, no, I still like my work. I just need to set better boundaries.
Yes.
And say no when I really can't.
Yes.
And believe that the universe will take care of everything else.
Yeah. And another one too that I've seen you do is ask for support.
Yeah.
When you need it,
Yeah.
right? No need to be the superhero.
Yeah.
We talked a little bit when we, were planning this podcast about the whole concept of physician heal thyself, right? What does it mean to you in practice? Not as a concept, but something you have to live.
I think the physician will have to walk the talk.
Yeah.
And really look into your own lifestyle, diet, exercises, sleep. I think boundaries are very important. We're coming back to boundaries again, to any physician, any healthcare physician, any healthcare providers.
Yes.
I mean, the reason we are in healthcare is to give. But sometimes when you give too much, you have nothing for yourself left.
Yeah.
Then what else is there to give?
Yeah.
Yeah. I think that's a very important reminder. The other piece is, again, make time for yourself. You only have space to think about what you need when you have rest.
Yes.
Even doing nothing.
Yes.
That's where you kind of realize, oh, I realize I've not done this for a while, not sleep enough for a while, because I'm a mom,
Yeah.
wife, the doctor,
Yeah.
and a daughter too.
Of course.
Yeah, there's
Many roles.
many roles that you're playing in. Often as women, we tend to forget about ourselves. It's easier said than done, to be honest, Kat. Most physicians don't heal thyself.
Yeah.
Most physician end up falling unwell.
Yes.
Yeah.
Yes. Oh, I've seen this.
Yeah.
I've seen this many, many times. And something that I actually do and I'm very passionate about is to support doctors, through the burnout, through the pressures. Because I think even when I was in medical school, there's no support.
There's no support.
Especially during our time, right? Which is 20 over years ago.
It's like the physician is expected to give.
Yes.
And give. And there's no need physician to do anything in themselves.
Yes.
And it feels as if it's wrong if you ask some time for yourself.
No, for sure. For sure. And the expectation was you just suck it up.
Yeah.
And deal with it.
Yeah. And the most, I think, after going through a lot of those, I guess, therapy work with somatic and trauma work, I realized the physicians face, in a hospital setting especially, you kind of face life and death. No one process it for you.
Yes.
You're not expected to process. You're supposed to move on.
Yes. Or repress it.
Or repress it.
Yeah. Shove it under the rug. Stuff it down.
Just move on.
Yeah.
Move on. Everybody does that. Yeah, but you realize that's actually not right. Because we are human beings.
No, definitely.
Yeah.
And I want to just tag on to what you mentioned earlier, what you're expected to move on.
Yeah.
But the question is, do you really move on?
You don't. You think you're moving on.
Yeah.
But unexpectedly, all the repressed emotion is in you, and it drives mental health issue.
Yes, for sure.
Big, yeah. Your belief system, your mental health, and that's a very big piece, I think.
Yeah. Let's go back to boundaries. So I love this, and it's a huge topic for us, and we talk about this, personally when we have lunch and all that. But how it's difficult sometimes to set the boundaries, but it's a must do. It really is a must do. What are examples of boundaries you've set, whether it's physical boundaries, time boundaries, or energetic boundaries that are for you, have really worked?
I think one of the big piece in the clinic, it's the time boundaries.
Okay.
So I have limited, there will be emails and WhatsApp asking for opinions and what to do and what's next. Nowadays, I've asked them all to make an appointment for a review, even if it's a short 10-15 minutes.
Okay.
It could be a phone, could be the video. So I take my time off all those emails that comes after office hour.
Yeah.
The clinic hours are fixed. We end earlier. So anything after, it's going to be, if they can't, they have to wait. So I think learning how to say no, it's also not easy. Also teaching my team to tell patient no, it's another big piece as well. Because everybody thinks they are most important.
Of course.
Yeah. The energetic piece is very important too. So I always visualize a line of bubbles or fires are enlightening, kind of encircling me, protecting me from to the bottom, and spiritually. Do quite a lot of prayers before I start the day and where the ends of the day. That helps. I mean, I'm not perfect. I lost it some days too. Yeah, but it's okay. I'll do better the next day.
Yeah. And knowing to come back to your center, to ground yourself.
Ground myself.
Right? And to find yourself again amidst all of that.
Yeah. I think it's very important for everyone to find things that can ground them. Everyone is different. There's no best way. You just explore.
Yeah.
Yeah. And you'll be able to find tools that. Yeah.
What are the tools for you that work? So something that we share in common is that energetically just, surrounding yourself with the golden light or the fires. And I love that. Another one that I do, and we talked about this, is I do kind of like a surgical hand wash, I mean, if I can, in between clients, and just like using that ritual of washing my hands to imagine that, okay, I'm letting go of this energy. And sometimes, in the coaching that I do, it gets quite heavy, and as it does in your medical practice, right? And that really helps. Another one that I do is essential oils, right? So peppermint's my favorite, and just being able to shift myself mentally and emotionally afterwards. Is there anything like that you do in between?
I tend to get up from the chair to open the door for the patient to leave, and I walk out to greet the patient in.
Oh,
So I realize it worked like I would intention. It becomes like a ritual.
Yeah.
It's as if you can leave the space now, and now it's the next person coming in. That space is for the next. So I find that very useful.
Oh, that's wonderful. And it's so simple.
It's so simple. It's just a few seconds.
But the difference for you
huge.
is intention.
Yeah.
Right? Because a lot of people can do that. It's like normal for them. We'll walk the patient out, bring the new patient in. But for you, it's the signal. It's the end. It's closing that book for now.
Yeah.
Yeah, I love that. That's wonderful. As was mentioned earlier, right? So even in your own life, working with your relatives, working with your own children, a big philosophy for you is food is thy medicine. Big one. It's not just about nutrients or supplements. Let's be very clear about that. But it's a relationship with nourishment, listening to what your body needs. What does that mean for you personally?
I think it goes back to what you said, listening to what the body needs. If you had salad and you feel miserable, bloated, uncomfortable, then don't have the salad.
Yeah.
It doesn't matter how nutritious the salad is. If your gut doesn't like it, it's not going to absorb. And you feel worse. And if you continuous eating the salad for a month, the gut's not going to be happy. The body is not going to be happy. Change to cooked vegetables, steam, blanch, whatever form, and you will feel better after eating. That's probably the right diet for you. That's what I go with. There are many forms of diet now available. Fortunately, there's no one size fits all.
Yeah.
You've got to try and see what fits the best for you. Obviously, the big no's are no processed food.
Yeah.
Anything that you kind of can't get from a tree or ground, don't eat them. No sugary, no extra sugar unnecessarily. I mean, occasional treats are fine. And no colorings. Yeah. Anything that comes with additive colorings is
That's like everything.
you try. Like I said, you try your best. But if you're eating whole food, you won't have colorings because those things are not present in nature.
And what have you seen with your patients who've shifted into whole foods? Those, I'm sure, who've had chronic diseases. What's happened for them?
Most will feel like they feel happier, sleep is better, energy is better. Some will have no more joint pains. Some the digestive issue just resolve by itself. But it is very complex. You can't say that if you do this, I'm going to feel better. There are also some that change and then
nothing's happened.
Nothing's happened. And there will be some like, eat very healthy, doctor. Now I'm eating more nuts. I'm eating more like tomatoes, more vegetables. And then some kind, why is my symptoms worse?
Oh, that's so interesting.
Yeah, because there are some content or some nutrients in the food that's not really suitable for them. I mean, that's a bit complicated. Won't go into detail, but it's just saying like some react to some of the ingredients like salicylates, amines and things in the food and trigger some of their symptoms. That's when you go into more individualized and see if the certain fruit groups they will have to temporarily removed.
Yeah. So it's very bio-individualistic. It's very bio-individualistic.
Yeah.
Right? So it's not the same. There's no one size fits all.
There's no one size fits all.
Yeah. Yeah, no, for sure. So walk me a little through your own philosophy for your family. Because, you have 2 young kids, right, who are in school. And are there any specific nutrition rules from the doctor? Right?
So we are dairy-free and gluten-free at home.
The whole family.
At home, my husband still takes gluten.
Okay.
But definitely dairy-free at home.
Okay.
My son is 14.
Yeah.
So I can't control what he eats outside. But at least he's aware. He's aware he shouldn't be eating. If he takes it, it's just a small treat. Obviously the usual things with no additives. So there's no candies, there's no fancy chocolate bars. If they have chocolate, it's dark chocolates. No any others. And there's no sugary drinks at home. The most is sparkling water.
Yeah.
With slice of lemon. Why he drinks outside, I can't control.
Of course. With
school, but at least we can do what we can at home and make sure they have 4 to 6 servings of vegetables every day.
Yeah.
And then take that soups and broth every day.
Yeah. No, so really about nourishing
the body.
Yeah, that's a big one. Yeah. You talked a little bit earlier about when you've shifted the diets of your patients, and you've done this for yourself, you've done this for your family. They feel better, not just physically, but mentally and emotionally. They start thinking clearer as well.
Yeah.
Can you talk to me a little about the science of that?
Yeah, because some of the foods, example, like they have enough studies to show that gluten, for example, can be neuroinflammatory. Or it can cause the tight junctions at the gut to be a bit more lax,
A bit more leaky.
I try not to use leaky gut word because it's like the popular word now. I mean, that's where the evidence lay. I mean, I'm not saying everybody will have a reaction to it, but if you do have a reaction to it and you feel better without eating it, then it's just the body telling you, don't take it. I don't like it.
Yeah.
Just listen to me.
Yeah. No, I totally agree. And sometimes we don't even need an expensive, complicated lab test.
No.
Sometimes it's just a process of eliminating certain food for a certain time and noticing, pausing long enough to notice, are you feeling better or not?
Yeah. I mean, again, it doesn't have to be perfect. Once you realize that food impacts you, then it's your decision whether you want to take it or not.
Yeah.
Yeah.
And have you seen patients who've noticed, for example, right, that gluten or dairy does make them feel a little bit bloated, a bit uneasy, but they've chosen to say, but I love my gluten, I love my dairy, I'm just going to keep on going.
Yeah.
Yeah.
But then that's their choice.
Yeah.
I'm not here to decide for them. Yeah.
Yeah.
Yeah. Just respect what they decide and we do what the best we could do.
Yeah. No, for sure.
Yeah.
I got that. What have you learned about yourself throughout this journey of the physical, the emotional, the spiritual, that you feel you didn't know when you were a medical student?
Oh, that's a lot. Like medical school was just teaching about physical stuff. Very physical, organ-based system. They completely forgot about fascia, cell, nervous system, how the gut is connected to the brain, how the gut is connected to the heart.
Trauma, as you mentioned.
Yeah, relates to heart and where the nervous system sits, where the vagus nerve sits at the brainstem, where the sympathetic trunk sits, and how muscle movements can also impact the nervous system, how the neuromuscular junctions are all interconnected. It was very compartmentalized.
Yes. Systems-based.
System-based, but there's a reason why the systems are in one human body.
Yeah.
Yeah.
It's all interconnected.
It's all interconnected. Yeah, but it's just so end up to be you just see gut as gut.
Yeah.
You just see respiratory as respiratory. You see heart specialists for heart, but forgetting they are all actually sitting in the same human body. Yeah. So and then the other piece is the spiritual piece is also very powerful. Because wholeness is when the physical, mental and spiritual piece all intersect.
Yeah.
Yeah. I think that's another big piece because it really grounds you, your belief system, your mental health. You're pushed. How do you see life? How do you see stress? Where do you go back to ground yourself when things doesn't go right? Yeah.
Wouldn't it be amazing if we knew all of this when we were
that
young?
would be amazing. Can you imagine? You don't need to know all. You just need to know it exists this way. It will be entirely different from any doctors coming out from that 5-6 years of medical school. Totally different. We're not saying the medical school training now is no good. It's great.
Yeah.
It's amazing for all the acute injuries, for all the trauma, for the accident.
There's a place for it.
There's a place for it, but it's not the only system. Yeah.
And keeping an open mind to that. That sometimes there needs to be a multidisciplinary approach, right? To really be able to help the patient. Yep. And yourself and ourselves, by the way.
True.
Realizing that. So, for my last question that I ask a lot of my, all of my guests, and you can pause, take it. We have a lot of time, by the way, so you can take your time. How would you hold space for your past self now, knowing what you know?
I think I ask myself to slow down. Don't need to be perfect. You don't need to treat everybody. Put yourself first. And don't ever do a postgraduate exam when you're pregnant.
Oh my gosh, yes. I get that. And I can
Like-
personally relate to
like-
that as well. As you know, I had my son, I did my licensure exam
Oh my God.
8 months pregnant with my son, and I went into preterm labor during the exam. So yes, I totally
Don't
agree.
ever, like,
Don't ever do
don't
that.
ever do that. Like, nobody tell you. They will just show you, well, I did mine too.
Yeah.
Postgraduate when I was pregnant. I'm fine. I'm like, yeah, don't ever do that.
And what do you think is the impact on the pregnancy on the baby?
I think it draws a lot of anxiety and stress. You're tired. You're not sleeping enough. You're vomiting away. When you're stressed and tired, preparing for exams, there's no rest and digest. Yeah. How is that impacts the baby? Because the mother emotional states during pregnancy is so important to the baby. And this was not taught too
No.
in medical school.
No. No.
No.
No, definitely.
It's never taught.
Definitely.
Yeah.
And no, I can totally relate to that. And for me, it was being taught that you just need, as we mentioned in the beginning, right, that you just need to power through.
Yeah.
But for the sake of what? That's the question I
Yeah.
ask now.
Yeah. Why?
Yeah, what for?
Yeah, what for?
I love that. Thank you so much for being here.
Thank you,
I
Kat.
so appreciate you. That was so fun.
inviting.
And I hope that people listening, will understand what it means for physicians to hold the space. And also that we too are human.
Yeah.
We also need to take care of ourselves in the process. So
Thank you.
Thank you.
Thank you.
Love it. Thank you for joining us for this conversation with Dr. Loo Hui Voon. This podcast is for informational purposes only and does not constitute medical advice. Please consult a qualified healthcare professional for any medical concerns. If this episode spoke to you, please follow the show and share it with someone who's been holding space for everyone except themselves. This is Unpolished Wisdom. Until next time.